Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And today, I would like to announce that this is the first day of National Public Health Week. During this is a very special occasion because throughout the country there are events that take place in order to kind of talk about some of the major public health issues that are taking place more recently. Um, there's, of course, before anything starts, the president gives a speech regarding public health and almost like a State of the Union of just for public health. So let's see. This year, he actually gave this lecture on March 29th, 2024. This is a proclamation on National Public Health Week 2024, and I'll start by reading the first paragraph and then kind of skim through this. During National Public Health Week, we celebrate the life-saving care of public health professionals who work tirelessly to promote our country's health, safety, and well-being. We recognize that the healthier Americans are as individuals, the stronger we are as a nation. So then he goes into the pandemic and vaccinating 230 million Americans and getting kids back to school. That was a challenge. Also, the first millions of first responders and social workers, doctors and nurses, scientists and researchers played a role in trying to address COVID-19. Public health professionals have always played an essential role in the life of our nation, working to boost immunization, safety for food and transportation, protect clean air and water, and much more. Um, then he talks about the Affordable Care Act and expanded coverage through that. Today, more Americans have health care coverage than under any other presidents, and millions of families are saving an average of $800 per year on insurance premiums. We have also invested 7.6 billion in community health centers so people in rural and underserved areas can get care close to home. Um, he continues to talk about capping the cost of insulin. That is $35 per month for seniors on Medicare, and it used to be $400 a month. So that is an improvement. Finally, getting Medicare the authority to negotiate lower drug prices. And that's something that has been part of this administration is lowering costs of medically necessary items. Um, Starting next year, no senior on Medicare will have to pay more than $2,000 per year in total out-of-pocket drug costs. Not even for expensive cancer medications that cost many times more. Um, he goes into some research and what type of research is being invested on, funding scientific research that will help us make quantum leaps forward in the prevention, detection, and treatment of deadly diseases. He actually established an advanced research projects agency for health that is securing $2.5 billion, and this was a deal actually that was struck in a bipartisan sort of movement where scientists, innovators, and public health professionals can be making these advances. Um, Cancer Moonshot was something that for First Lady and Joe Biden reignited. They actually set a bold goal to cut cancer death rate by at least 50% over 25 years. So women's health research is also important. Going into state abortion bans that put women's health and lives at risk. He's not for restricting abortion to the point that Roe v. Wade was reversed at that point by the Supreme Court. He's a person that's against that, and many people are. And so abortion bans actually risk and threaten doctors with jail time for providing the health care their patients need. And he talks about Roe v. Wade. Um, he also talks about Vice President Kamala Harris leading the effort to combat maternal health crisis that is gripping our country. That has been especially devastating to Black and Native women and women in rural communities, where maternal mortality rates are unconscionably high. Historic improvements, investments in mental health, and then, of course, some barriers to treatment of opioid use disorder that was expanded, and also access to opioid overdose reversal, like naloxone, that was continuing to advance efforts. Um, he also launched the first ever White House Office of Gun Violence Prevention. This is an area that I'm working on with other collaborators a lot. I was also proud to sign the reauthorized Violence Against Women Act, building on the law that I just wrote years ago to expand protections and resources for today's domestic violence survivors. He talks about climate change, poisonous lead, having supporting clean water, providing millions of students with free nutritious school meals, and then he talks about the G20 summit and partners that has invested money into combating challenges like HIV, tuberculosis, malaria, cancer, and COVID. So how does he end? He says that, of course, he talks about National Public Health Week. He's talking about, this is really interesting, about the interconnectedness in everyone's health and well-being. If one person is affected, that means the whole population in some way, shape, or form is being affected. He ends by this: by continuing to invest in public health, we can help ensure that the lessons of the last 4 years make our nation stronger for the future. Um, and then he ends by, in witness whereof I have hereunto set my hand this 29th day of March, in the year of our Lord 2024, and of the independence of the United States of America, the 248th. So this is an overview of what Mr. Biden went over on March 29th. I hope this has provided some insight. Thank you for listening.